If you're a dentist, absolutely have to do a birth history. You have to do the history of the mom, the pregnancy, the birth history, the nursing history. And the reasons why is because if something went wrong there, say there was like a lot of compressive forces at birth, the baby has torticollis, the baby came out with forceps, the baby came out and couldn't nurse, have to take a good history to be able to see this baby needs to see a cranial osteopathy. What are the forces, the physics behind why teeth are in certain positions, and it all has to do with the soft tissue influences. And this is something that dentistry completely misses.
Hi guys, welcome to Tales of Transformation. I want to introduce you to today's guest, Dr. Tasha Turzo, and I really hope I've said her name correctly. She is an incredibly inspiring lady. Having just had this conversation, I feel so in awe of a powerful woman who is able to study various different topics and speak so eloquently and confidently about those topics in such a way where you can really tell she has understood, embodied, practiced, and fine-tuned her knowledge and understanding in these areas, and who is also a mother and speaks of motherhood in such a fond way, and shares how the role of being a mother is so important and is one of the most transformational roles that she has. And as is the struggle for so many of us who want to deepen into our careers or into our passion projects or our soul's purpose, and who also want to be present and loving family members and parents, I believe that she's a beautiful example of how that is possible. So Dr. Tasha Turzo is an expert in the fields of osteopathy, homeopathy, functional medicine, and specializes in craniofacial dysfunctions. And I love how this conversation is so appropriate for clinicians, practitioners, medics, dentists, and healers, as well as for people who are truly interested in real wellness, real wholeness, real health, and who want to set themselves and their children or their future children up for a lifetime of beautiful health and thriving, and also to recognize where one condition may be linked to something seemingly unrelated. She really provides that wisdom and that transmission of how we can truly heal. So do watch this whole thing. It is just enlightening.
Hello.
Hello. So nice to see you.
Nice to see you too. What a beautiful background that is.
Thank you. It's my front room, so I don't have sofas or TVs or anything. It's just enough space for me to meditate and do yoga, so we're good.
Love it. It's the meditation and yoga room. Everyone needs one of those. I have one of those too. Just love it. Beautiful.
So welcome. This is this program is called Tales of Transformation. So I'm talking to people who I believe are doing things differently, who I'm really inspired by, really curious about what they're doing and how they're doing it and how they got there and what it means to do it in that way. So it could be in the realm of health or of business or spirituality or the way they are conceiving and birthing their children. So just across all aspects of life and reality, just giving people a permission slip to think about things differently outside of the way we're forced to in the kind of conventional, centralized medical and educational systems. But like, why am I doing this? And is this the life that I want to live? And what is going to help me live in the best way possible so I can be as loving as possible, so I can function well, and I can have a beautiful family and a beautiful life. So that's why I have you on.
Wow, I'm completely inspired by that. Transformation is something that when I meet a patient for the first time, that's what I talk about. I'm like, that's what I'm interested in, is full transformation. And how do I support your full transformation? So, yes.
I love that. I love that. So let's start by asking you about your background, your educational background. So what did you study and how did you get here to be doing this work?
So, yes, I'm an osteopathic physician. So, in America, there's two different ways to become medical physicians. One to do a 4-year program in an osteopathic medical school, and the other is to do a 4-year program in allopathic medical school. We go through the programs. The difference is in an osteopathic medical school, we learn 100 to 500 hours worth of information on how to treat and diagnose and treat neuromusculoskeletal problems.
Yeah.
So we come out with like the basics of how to work up back pain or neck pain or shoulder pain or foot pain. The osteopathic principles are that there are the body's a functioning unit. Structure and function are reciprocally interrelated, and I can talk a lot about that later. And the body has a capacity to heal itself. So those are the three basic principles of osteopathic medicine. It was started in the mid 1800s to late 1800s in Missouri, United States. So I'm an osteopathic physician. And again, in America, we're fully licensed physicians. After we finish our 4 programs, we specialize. So I did family medicine with UCSF and training there. But I also did 5 years of medical school instead of 4, where I got a scholarship and I was able to teach the first and second year students the osteopathic practices and principles and be a tutor within the anatomy labs. So I did 5-year of medical school. So I came out with extra education on how to work as a traditional osteopath. And then I did a 4-year training in classical homeopathy, which I absolutely love. My main teacher is from India, Dr. Rajan Sankran. Studied with him for 30 years now. It's something that I use a lot in my practice, and it keeps a patient intact as a whole being. So a lot of the ways that we're taught in the traditional medical experience and the dental experiences is that we take pathologies, and that separates our mind and boxes people into these little boxes. And then we miss the big picture of the whole human being, which is really what we're interested in helping. So, and, we all know that the sums are a different experience than the parts are different than the sum of the whole. So homeopathy keeps the patient whole in the sense that we're treating mental, emotional, and physical aspects of a human being. And I also do, so I have a specialty within cranial osteopathy. So I treat people from head to toe. I don't just treat the cranium, I treat the whole body, but I certainly specialize in craniofacial dysfunction. I started working with the ALF appliance about 30 years ago when Dr. Derek Nordstrom, who is the founder and the creator of the ALF appliance, started coming to my office once a month. And with our collaborations and working with patients together, we were able to learn a lot about the appliance and fine tune it for each individual. I've written a book called The ALF Approach, and it's all about root causes for teeth crowding syndrome. So the teeth and the position of the teeth are a symptom of a whole host of other things, which I can very much go into. Then I also do injections. So I do PRP and prolotherapy and now exosome injections all over the body and all the joints to be able to help to optimize stability. So with osteopathy, we can loosen things up and we can take out the compressive forces of the tissues. But if someone's had a compromise to their ligaments and tendons in one place in their body, osteopathy is not going to be able to stabilize that. And we need to stabilize that. So I use these injections to be able to stimulate the body to heal itself. So that's the other aspect of what I do. And then I have 3 different medi-spas that I'm medical director for. So I have access to IV nutritional therapies and injectables and a laser for collagen regeneration in all aspects of the body, including the back of the throat, to help lift it up with airway dysfunctions. So that's kind of the big picture of everything that I do.
I am blown away. That's amazing. I'm like, is there anything else that you don't do?
I'm like, did I miss something?
Yeah. And your mom.
And I'm a mom. I've got 2 adult, beautiful daughters, and I have a beautiful stepdaughter. So my stepdaughter is 17, my youngest bio daughter is 23, and my oldest is 25. So still mothering.
Yeah.
And yes.
Yeah, that's a lifetime job.
It is a lifetime job. You wake up and they're still there every day. You're like, oh, they're still here. Okay.
Yeah. Yeah, I definitely do that to my mum. Like, hi, I'm here. She's like, you don't live here anymore.
Yes.
Love
It's
it.
wonderful though.
Yeah.
It's the best. I mean, it's the most meaningful experience in life, really, is uh, and it also is the most challenging. I mean, everything else pales in the comparison to that job.
Yeah. Yeah. Thank you for saying that. That's like inspirational. That's inspiration in itself. Like just to remind women and men and families how important that role is in being a
100%.
parent. Yeah. So tell me a little bit more about this philosophy of the body can heal itself, because I believe that
Yes.
wholeheartedly. I don't know if you've heard of Dr. Joe Dispenza. Um, and I've done a lot of his work over the last 10 years. And, you know, the body is so intelligent. And when we support it, it just knows what to do. So tell me more about it from your expert perspective.
So it's kind of like this. If we have a cut, we can put a band-aid on it, which is creating an environment for the body to heal, but the body heals the cut or the wound. And just coming in with that perspective is a perspective of is a humble perspective. So if you're coming from the place of the body can heal itself, that already is starting with a non-invasive approach. And it gives us pause and allows us to receive and hear from the patient what is happening. So when I see a patient for the first time, it's a 2-hour appointment because a lot of what I'm doing is listening. We've been with our bodies for a long time, especially people who have very complex medical history and have been through a lot of suffering with chronic illnesses. There's a knowing that they have of what it is that they need, and we just need to give the environment for them to be able to talk, to listen, to express. The same sort of thing is that when I'm listening to a patient, my mind is trying to find where's the obstacle for this person's health. What is blocking this being from being able to heal themselves? Sometimes it's a food allergy, right? So if you've got a food allergy, environmental allergy, that nose is going to be congested, that mouth is going to pop open, and we're going to have poor facial growth and development. Sometimes it is microtoxicities or environmental toxicities. Sometimes it is sleep habits. Sometimes it's on the phone too much Wi-Fi interference. So it's listening for where is there a disruptor in this being's health. His A.T. Stills, who's the founder of osteopathy, has a saying that anybody can find disease, but who can find the health? Because we only heal from our health, right? Like if you think about it in partnership, we're in partnership, whether it's a partnership with a beloved or it's a partnership with a parent or a partnership with a coworker. When someone points out our faults, it's not necessarily an easy place to heal from. But when we're said, oh, wow, you're really wonderful, or you have capacities with any, X, Y, and Z, that uplifts us. And that's the place that we heal from. So we heal from our health. We don't heal from the disease. The health heals the disease. So how do we augment the health?
Oh my gosh, yes. That is so beautifully put. That is healing to hear, you know,
Yes,
that is healing to hear. And I think if if all of us as clinicians, health practitioners, you know, in the healing space were to take on that approach, we wouldn't be chasing after disease, just trying to patch things up.
that's right. There's a lot of patchwork that happens, and the patchworks, we don't even, in medicine, we don't even have really good patchwork capacities and materials, right? And we don't even necessarily have patchwork to deal with the new illnesses that are coming through. The amount of gut issues that we're having now just in children is huge, right? So we need to develop new modalities, and we to not just diagnose but also to treat and to keep our eyes on the health.
Where do you think things go wrong? So we have a newborn baby,
Mhm.
perfect, everything is good. Where is that point where things start to tilt in the other direction?
Love the question. The tilting can happen in utero.
Mm.
Nowadays, we really have to ask the questions. It's really about asking the right questions. So we have to ask the questions to the mom, like say I'm treating a newborn.
Mhm.
How is your gut health? Did you have more than 10 rounds of antibiotics?
Mm.
How is your sleep? Do you open mouth sleep? Do you snore?
Mm.
Um, did you have a dental work? What dental work did you have?
Yeah.
Um, what childhood illnesses did you have?
Yeah.
How has your health? How was your health during pregnancies? I mean, that's just some of it,
Yeah.
right? If mom has airway issues,
Yeah.
that baby is growing within the womb of a low oxygenated environment and will come out with the facial features and the structures that express sleep apnea.
Mm.
So that's one of the reasons why we have all these babies now that are being born retrognathic with the mandibles further back,
Mhm.
because they're growing within the womb of a mom that has this airway issue.
Yeah. Yeah.
And then we have the birth. So the birth these days, our health of our bones is weaker. And we have more intervention in terms of epidurals and Pitocin. Pitocin increases the contraction of the uterus. So those combinations are not a good combination, where we have more compromise to our tissues
Mhm.
and the strength and health of our bone, and we have a more forceful intervention for birth. So many of the babies come out with what's called cranial nerve compressions, and that's in chapter 3 of my book, and very, I think, is so key to so many of these people with craniofacial dysfunction, is that it actually started at birth.
Yeah. Yeah.
I
Gosh.
don't think that was good news for you, because you were thinking, oh, perfect birth. It was like, oh, well, wait a second, let's go back.
Yeah, yeah. I mean, it's definitely something I've talked about or thought about in terms of
Mhm.
like maybe, it's even like preconception. It's like how she set herself up. What is how much minerals has she kind of accumulated and got her body ready for that kind of experience? And is she maybe like doing kind of hip yoga and stuff to be able to set herself up for to birth vaginally and to birth without intervention? And even just energetically, what environment is she in, and how is her relationship, and how is her nervous system, and all of those pieces. And I feel like we don't have those conversations in kind of the centralized conventional spaces. People just come in and they're like, whoops, I'm pregnant, and that's okay. But you have about 15 cavities and all sorts of problems going on. And I would love for people to be inspired to be more intentional about this really sacred process that is creating your family, that is creating your descendants. Like, how can we be a good ancestor? And I think that's a really good place to start. So, yeah, that's incredible. Especially the piece about the compromised oxygenation of the mother whilst the baby is still in the womb, and how that translates into this face that is then set up for sleep disordered breathing and other issues. That is
Absolutely.
profound.
Yes.
Wow. So I guess the next question is, let's start talking about the ALF appliance. So tell me what it stands for and what the appliance looks like, what it is, etc.
Okay.
Yeah.
So it stands for Alternative Lightwire Functionals. And it's alternative because the predecessor to the ALF was a Crozat. So for those of you who know the Crozat is a wire appliance, but it's much thicker.
Okay.
And it actually has a palatal bar that goes across the palate. So the ALF was created from the Crozat. And in order to make it lighter, so that it actually augments motion. So and to take away the palatal wire. So we want no obstruction for the tongue to be in the roof of the mouth. This is coming from the study of a lot of what is the basics to craniofacial growth and development. So if we want it, we have to study what normal is in order to create a dental appliance that actually is biocompatible, which means it mimics the human physiological forces that grow a face. So let me just say that again, because this is key.
Yes.
The key is, if you want to have an integrative approach to solving the issue of low oral volume, let's call it low oral volume, and intraoral dysfunction, both of which create crowding of the teeth. We need to study what normal facial growth and development, how it works. And Enloe is the book. So I've read Enloe. It's a wonderful book because it's spoken in function. Enloe is the kind of still the Bible, let's call it, or let's call it the important book of facial growth and development. And in it, we know that the face grows down and forward. So when we're born, our heads are kind of not that much bigger than what our heads are now, but our faces are very, very small. And they grow downwards and forwards, and they become larger because we're using them. So the functions of the face is what grows the structure of the face. And we know that what grows the mid-face is the tongue up in the palate, a functional swallow, which is up and back, tongue up in the palate, and then up and back, and nasal breathing. So when we do those functions, we grow our mid-face forward, which is our maxilla forward. What develops the mandible is a good functional chew. So when we have our teeth hitting on those first buys, that actually stimulates bone growth and development, and our mandible drifts forward. It's actually interesting. It actually specifically grows backwards, like the growth centers are here, but it drifts the face forward. That's why I called it drifts the face forward. So important for us to look at embryology. So when I teach my courses, I talk about the embryological development of the face and then how a face grows throughout childhood, because we want to be able to do an intervention to see, oh, is this kid still growing? It's like a growth chart. We want to say, are they still growing a normal face or a physiological face? Mm-hmm. The ALF was created to be able to integrate the root causes for low oral volume and crowding of the teeth. It goes behind the upper maxillary teeth and the lower, so you can't see it, which is beautiful. Mm-hmm. It's very comfortable. And it doesn't obstruct the tongue from getting up into the roof of the mouth, which is what we're trying to integrate. It actually stimulates the tongue to go up to the roof of the mouth, which is a neurological reflex. So when people have low-lying tongues, it's actually a neurological dysfunction. There's a reflex that's not been integrated. It also has a special yellow alveolar wire. So it's a special kind of wire that has a flexibility to it. So it's got a flexibility and a stability to it. The flexibility allows when the tongue goes, the flexibility allows augmentation of the cranial motion. So all the bones in the head and the face have a very subtle motion. There's fascia that goes between them. In fact, the fascia that's on the outside, the most inner layer of the scalp, goes down between the sutures and becomes the innermost layer inside of where the dura is. And that is part of what is a scaffolding to support the brain, right? So it's continuous. That scaffolding of the fascia that supports the brain goes between the sutures and becomes part of the scalp.
Wow.
We have sutures in our head, so that as we fall on our heads, you can see that we have motion, right? So this is kinetic and potential energy, basically. We can have a slide, and that absorbs the compression, which protects the brain. Mm-hmm. And that's why we have bones around our body, is to protect our organs and to allow muscles to hang on to help us move. Those are the two functions for the bones. Yeah. So we also need to have motion within the cranium, because this subtle motion is also the movement of the central nervous system. And this is what is the motion that drains our brain. It's called lymphatics. And the brain drains mostly at night when we're sleeping. And there's no muscles inside of our scalp or inside of there are muscles in the scalp, but no, inside of the head that cause compression, decompression, which drives the lymphatic system. So the only thing that drives the lymphatic system in our heads is the subtle motion of the cranium and the swallow. Yeah. So when we have a good functional swallow and we are able to swallow up and back, and we can kick up the back of our tongue. So if you say the word g, 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 is kicking up the back. When we kick up the back, we get our temporal bones to external and internal rotate. And the place where 80% of all this is the junk, the byproduct of cellular respiration inside the brain, in the brain, drains, is right between the temporal bone and the occiput. So that is literally a space between two bones that needs to have optimal motion to allow this compression expansion to allow the brain to drain. And it also drains down right behind the sternocleidomastoid and what we call these deep cervical lymph nodes. And if we have any kind of torticollis or neck issues with the SEM, we are going to have compression of the lymphatics draining from our brain and can get brain fog, memory issues, and so forth. So they did these studies in rats where they actually took out the lymph nodes, the deep cervical lymph nodes, and what happened was they had cerebral edema, which is brain swelling because they couldn't drain.
Exactly. Got it.
So the ALF appliance is a very holistic, integrative approach to optimizing health and removing the obstacles that created the dysfunction.
I'm like, give me one. Love it.
Yeah.
So let's talk a little bit about the intricacies of like how it actually sits. So it's sitting behind the teeth, and does it have clasps? Is it clasped around the molars? Is there any forces that are being applied to the teeth, or is the force onto the palate itself? Like, how does it actually sit and work?
So it claps around the molars, usually the first molars. And then it has the wire that goes from in an arch form. And it has, I wish I have one. I can maybe show you a picture in the book. It has omega loops, which is what is activated. So it gets taken out once a month by the ALF dentist who is doing the activation. And what they do is use a wire to widen the omega loop. And in that way, the wire expands. That's actually what it looks like.
Beautiful. Yeah. Got it.
So there's no direct palatal forces. The forces are actually on the teeth, and the wire sits on the CJ junction. So you're actually also stimulating the periodontal ligament to stimulate bone growth. We're actually creating bone growth. And in order to create bone growth in a physiological fashion, it also can't be hard forces. It has to be a slow, gentle force, and then you grow bone. That's how we grow these little nooks and crannies, like on our elbows and things. They're created because of a tension.
Yeah.
But it takes time to really build that tension without creating a compensation because it's too much force. So when you compare it to the rapid palate expanders or even the palate expanders, one is that it is a physiological force because it's the same shape as the tongue. So you may ask the question, why do we have teeth in an arch shape? Right? Why do we have teeth in an arch shape? We could have them like pointed like this, and they still would come together. We could chew, but they're not. They're in a form of a, and that's because of the shape of the tongue.
Yeah.
So the shape of the tongue is what creates the shape of the palate and the position of the teeth.
Yeah.
So it is we think of the ALF as a biomimetic tongue. It basically is activating and stimulating growth in the same way that a tongue does.
So when people typically come to you, what would you say to someone who just wants to straighten teeth? You know, they've looked at all the other appliances, the fixed orthodontics, the removable clear aligners, etc., and they're like, I like the sound of that, but my main concern is my teeth are not straight, or there's a little bit of something that I want to straighten out. It's very cosmetic. What would you say?
Well, I would say to them, let's figure out why your teeth are not straight. For example, I myself, I've never had traditional orthodontics. I've had the ALF, but I have this one tooth down here that's always slightly inclined. And it has been since I was a child, or at least a teenager. And I can do the ALF and I can straighten it out. But as soon as I take the ALF out, it goes right back. right? So we're talking about relapse.
Yeah.
Most people who want straight teeth, they've already tried the braces, they've already tried the Invisaligns, they've tried all these things. And then as soon as they take it out, they get a relapse. And then they're told you need to wear this forever or else your teeth won't be straight, right? The question that we're missing is why?
Yeah.
Right? So in order to do the why, we have to understand why teeth, what creates teeth position? What are the forces, the physics behind why teeth are in certain positions? And it all has to do with the soft tissue influences. And this is something that dentistry completely misses.
Yeah, totally. Yeah.
So here we go. The forces, the intraoral forces between a resting position of the tongue, a functional swallow, a good lip seal, those are these forces. And the normal forces is up and out. And that's what grows the face down and forward. That is the up and out, but the down and in is our facial function. So if we have asymmetrical facial contraction, we're going to have flaring of one side of the teeth and down on the other side. So the buccinator is a sphincter that makes our teeth straight when we have a good intraoral function of the tongue up and out. So what I have is a little bit of a jaw problem here because I had so many little head injuries, so that this jaw joint doesn't function as well and functions differently than this one. So when I swallow, I brace and this goes in this way. And as it does that, this right here pushes in to stabilize. So I'm using this part of my body to stabilize what I can't do well with my jaw joint. I'm still in process, but
yeah.
One day. But that's the reason why this tooth. And no matter how much I try to straighten this tooth, if I don't deal with correctly with this jaw joint and this temporalis that's had a lot of impact, I'm going to be using my face down here to stabilize my jaw when I swallow and when I eat. So looking for underlying causes. For many people, it's a tongue function. That when they swallow, the tongue goes forward and they have a retained anterior tongue thrust. And that's why they're pushing their teeth out. That's what creates class 2s. Right?
Yeah.
So it's looking at why specifically is this tooth going in this direction and assessing your swallow, resting position of the tongue, at resting position of the face, nasal breathing, and even head posture, right? So when we have tilts in our head, that puts our jaw joints in different positions. And so our muscles of our jaw are going to contract asymmetrically. That could be the problem.
Yeah.
Sorry, I have no quick fix. It has to be individually assessed.
Yeah, no, and that's perfect because of the knock-on effect of this appliance and how it's stabilizing everything. It's bringing everything into equilibrium.
Yes.
But so many people come with that aesthetic concern, right? That's the thing they see, and that's the thing they want to correct. And then they realize that it is about more than just that. But it's a blessing. It's a gift. It's a gift.
It is. And I do spend, there does need to be the education that function creates structure. So there's no way to have a sustainable structure if the function that creates a structure is still dysfunctional. Yeah. And that sounds so convoluted, but basically dysfunction creates dysfunctional structure. Yeah. You can't straighten something out when the dysfunction hasn't been integrated and isn't healed and functioning well. So if you can do that, then the structure is beautiful. I mean, that's why people like a wide arch, because it expresses, right, and a good jawline. It expresses a good forward face growth. There's something instinctual that we know about that.
Yeah. Beautiful. What would you say you know about the process of facial aging on a bony level, on a muscular level, and how those who want to keep their faces looking youthful and vibrant and having this amazing function and structure, how would they go about doing that?
Well, everything I've already talked about. So when you are, when the tongue is sucked up into the palate, and this is a lot of, what mewing is doing. So I just taught with Mike Mew, Dr. Mew in New York City last weekend. So the mewing is just as one small component of myofunctional therapy, which is tongue up. And so when we have our tongue up, we have a better activation of these muscles called our digastrics and the muscles underneath the submentalis muscles, and our temporalis and masseter. So basic resting position is going to form the correct muscles to make us look good ongoing in life. So there's the muscle contraction that helps hold the tissues. That's one thing. So having a functional swallow, which is an up and back swallow, resting position of the tongue, and good chewing. So I think the other thing is that if we want our babies to grow up to have beautiful faces, they need to chew.
Yes.
So we have so much of this like formula. We have now yogurts in little packages. We have like soft foods. We've got smoothies. But, we're not allowing our kids to like chew on bones anymore and chew on nuts and carrots and like hard things, because that hard things will develop your mandible, which is the bone that houses our airway, right? So we want to look good. We also need to feel good. So it's that health and function that really makes beauty, really. So the other things I would say is being aware of your own face and being able to, just like we work out our biceps and our triceps, it's like, can we lift one eye and then the other eye? Can we suck in our lips? Can we push out our lips? What is the function of our face? And I just recently, as of I think yesterday, I just bought a new fun toy for one of my Medi spas, and that's called M-Face. M-Face is created by a company called BLT that was created by a pulmonologist and a cardiologist. And what it does is they're little like patches that have electrical activations of the facial muscles. So we put one here and we put here, and we can even put one on the face. And what it does is tighten the muscles of the face. It's unbelievable. So I'm going to be using it to work with patients with Bell's palsy, to work with patients with TMD, to help to activate and to create muscle contractions that are symmetrical on both sides. But what also does is a beautiful facelift because it activates the muscles. And I also would say that, there's the Photona laser. This is what we do at my Medi spas. I have, again, 3 of them. Is we use the Photona Dynamis laser to regenerate the collagen tissue. We do something called a 4D and a 5D facial, which is absolutely amazing. And we use exosomes topically to help the body heal fast. So there's no downtime. So it's basically like a facelift, but it's all natural and we're not using any fillers. So we're just trying to optimize the natural beauty that's already there and not change our structure of our beauty that's already here.
Yeah. Oh my gosh, that's amazing. I love that. I absolutely love that. How would you say the ALF compares to other appliances, like Vivos, Homeoblock, all of these palatal expanders? What is the comparison, and why do you prefer the ALF, which you obviously do prefer?
I do prefer it. Yeah. As an osteopathic physician, looking and focusing on health and function, I have to be aligned. Only the appliance I could be aligned with is one that exerts normal physiological force within the palate, within the mouth. So that's the basic difference. So the Vivos and the Homeoblock, they go across the palate, so they keep the tongue low. And that's usually the main issue, is the tongue is low and we don't have good tongue posturing, and that's causing the problem. The forces are not physiological, again, because they are 2-dimensional, not 3-dimensional expansion, and you're not getting a nice arch development that mimics, again, the tongue. It also creates cranial strain patterns. So this is the biggest thing, is that it causes structural changes. When there's the palate expander that goes, this way, it ends up straightening the neck. So in almost every single X-ray and CBCT scan that I've seen, and I've seen hundreds, we lose our cervical lordosis. When we have the palate expander in, you actually get an overactivity of these anterior scalene muscles that straightens the neck this way. So you lose your lordosis and you end up being tight like this. And that's going to happen through the whole body all the way down. Because when you get a change in one cervical lordosis, then the kyphosis in your thoracic changes and it goes all the way down, including your feet kind of falling inwards. There's no way that we can put an activation of a non-physiological force in the body and not have it affect everything, because the body is basically one unit from the top of our head to the bottom of our toes. Everything's connected. There's even fascial dissections, and I have a picture in my book of how the tongue connects to the toes, right? So it's a closed system. If you push on this side, you're going to do this, right? You have compensations to it. So the other thing with the palate expanders, which is basically the Vivos and the Homeoblock, is that they're turnkey. So they're not individuated. And one person's capacity to heal is different than another person's capacity to heal based on a whole variety of reasons, from like how they were born, what compressive force went into them. Say this one person was, a forceps delivery, and this person was a C-section delivery. There's different compression forces, or this person had like 5 head injuries, all on the right side, right? That tissue is still compressed. So when you put something in to try to open it, one side is more rigid. So the pliability of the whole body, it has a lot to do with how someone's going to be able to respond to forces put into the body. And the turnkey is not individuated enough. So what I love about the ALF is that the activations are very individuated, which means that the first appointment or the follow-up appointments, the dentist looks in the mouth and says, oh, I see the wires pulled off of the CJ junction. That's because the arch is developing, because the tongue is getting up there. So the adjustments of the wire are just to keep up with the integration of the tongue function. So it's allowing nature to lead the process.
Yeah.
That makes sense?
Yeah, that does make sense. What would you say, because, I'm asking with curiosity because I've not worked with any of these appliances, and nor have I been a patient receiving any of these appliances. So I'm fascinated about the process. What would you say to those who really believe in the Homeoblock and who have seen results in their patients where there has been, at least a width expansion, and the patients are experiencing an optimization of their health in their subjective experience? What would you say has happened there? And what would you say could have happened if they'd used something else? And I think you've already answered it, but I want to kind of really get to the details of it.
I would say wonderful, fantastic, right? So any improvement in our health, and people absolutely have success stories with this, right? Like I had the Homeoblock and now I'm like can breathe and I don't need to have a CPAP, and I'm like, fantastic. You did well with it. That is wonderful. I do ask the questions, making sure that they don't have headaches, they don't have neck pain or back pain or something new that came up after they had the Homeoblock, because we need to make sure that we have, make sure that nothing else was compensated and causing a problem. For example, when orthodontists are putting on braces, they don't really ask all the time, do you have headaches? But what I see in my practice is they'll come in and they'll have headaches, and I'll trace it back to, oh, it started when I put the braces put on.
Yeah.
Right. So the correlations of the potential consequences need to be associated. And I would say absolutely wonderful. Some of the good old hardy human being who just has basic intraoral dysfunction, can handle the turnkey, great. Let's make sure your neck is okay.
Yeah. 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 So I wanted to ask a specific question that comes from my boss-to-be, who uses the Homeoblock and Damon braces. So it's a fixed appliance. I think you know a little bit more about it than I do. But his question was, I've written it down to get it right. He said, on its own, the ALF, he believes that there's a lot of tilting of the teeth. But in combination of using the ALF with the Damon braces, does that focus the forces down to the most central resistance point, and you get better bony growth in your experience?
Okay.
Does that make sense?
It makes total sense. I understand what he's asking. What he's saying is that the assumption is that ALFs tip the teeth
Mm-hmm.
And so he doesn't want that tipping. So if you do an ALF and Damien brackets are really a wonderful kind of brackets because they have less force on the tooth, basically.
Yeah.
So you're going to have less root damage and root absorption, reabsorption with the Damien brackets. And yes, many of the dentists, we used to do that. We used to finish our cases with an ALF in and Damien brackets. We don't do that anymore.
Yeah.
We use something else. The issue is this: tilting of the teeth is not an appropriate use of the ALF appliance. And I know there's going to be controversy in this, but we think of it we being like, I teach basically how to do the ALF approach.
Yeah.
That phase 1 is really about bone growth and neural integration and osteopathic, basically activation of the cranium. So we're not even focusing on teeth position. If there is tilting that happens, it usually means that it's been overactivated. So when I see those canines flaring out, I'm like, this dentist is pushing this person much faster than they can go. So we need to back it off and slow it down. At the phase we call phase 2 is after we have neural integration, we have the tongue is up, we have myo integration, neural integration, osteopathic integration, patient's symptoms are resolved and feeling good, and now we have this dental occlusion that we have to fit these teeth back together to create stability and sustainability for this bite. Then sometimes, so this is like, we're talking even after a year of phase 1. Phase 2 is like, okay, can we tip this tooth just slightly to get it to be in good class 1 occlusion?
Yeah.
But now there's other ways to do that. So the most common way that's least happening in America is it's kind of like an Invisalign, but it's not. I am not a fan of the Invisalign because it is a thicker material and it doesn't have a direct interdigitation where these teeth come together, and what ends up happening is TMD. I see this so much. So we're using something called SX, which is a thinner material that still has enough of an influence to reposition teeth. And we almost never say use the upper and lower together. We just do the upper and then with the lower, because when you have the two plastics together, again, you have this slide that happens.
Yeah.
And for people who are on the edge of having TMD, this just puts them out of alignment.
Yeah. Yeah.
So I hope I answered the question.
Yeah, so it's almost that if we're using ALF with our patients, if that's the treatment that we are offering, we need to know how to use it well, because if we're using teeth, we're probably not doing it properly.
100%. And this is the issue. It's way more challenging to use than the homeoblock and the orthotropics even, because you have to assess where to activate, right? It's not a turnkey. It's not has that, just protocol, like, right?
Yes.
The other ones you can have your assistants go in and just do, or you can have your patients do on their own. This is really something where you take out the appliance, and even as you take it out, you're assessing like, it's tighter on this side than this side. And that then tells you where do I need to activate the wire.
Yeah.
Do you have to, I don't know how anybody can just not do any courses and pick up the ALF and put it in and think that they can actually do an ALF. Like that, to me, knowing how much I know about the ALF now, I'm like, I don't even know how anybody could do that. Even just understanding the dynamics of activations and where you have to activate and do a contra activation to keep the wire in the same plane. The Lightwire is challenging because it's so flexible. You have to even get your pliers to be parallel and just right to be able to get the activation where you don't skew it like this.
Yeah. It reminds me of something that Dr. Jalal Khan actually said to me. He said, the ALF is like a Ferrari. It's an amazing car, but you've got to know how to drive it.
100%.
Yeah.
100%. And there are courses, like I have my online mentorship program. So I have an online course. Anybody can take the online course. So if you're interested in learning more about your own craniofacial dysfunction, the course is, it's heavy in anatomy, but people have taken it and said that they enjoyed it. And then once you take that online course, then you can come into the mentorship program. So the mentorship program, which I just taught this morning, is really fun. There's people from all over the world. Dr. Jalal Khan is in the mentorship program also. Again, there's people from all over the world, and we're all learning from ALF cases. So we present the case, we show the activations month to month, what it looks like inside the mouth, and then we talk about the holistic approach to, I consult on more on the osteopathy, the functional medicine, but also because I've been, in this world for so long, on where the activations should be, even the design. Next month, we're having one of the faculty. So there's three ALF dentists who are faculty, and they are doing the consulting on the wire bending, because I don't actually do the appliance. They're the ones that put the appliance in and they activate it. So she is teaching the very beginnings of it, how to work up a case, how to design the ALF, how to put it in, how to activate it, and how to, watch how to activate it for phase one. So and the mentorship program's been now 18 months, which means I have 18 2-hour videos on how to do ALF with many, many different cases. And if someone signs up as an annual associate, they get to see all of those. And I have a huge resource library for resources for people who are interested in practitioners working with the ALF. And an annual associate, also, you can present cases. So if you're starting out, you can actually be like, I need help with this case, and you can present the case for consultation. And then there's monthly members that can just watch the last month of the mentorship program and then pay monthly. Yeah. So that was my attempt to try to bring the world together in terms of having an ALF educational process that's based on patient cases.
Tell us a little bit more about the use of ALF in children versus in adults.
Super wonderful with children. If you are interested in starting to learn to use the ALF, start with children. It's just so much straightforward and less complicated. They're quite easy to treat, in the sense that facial growth and development is growing so much, right? It's like being a surfer and you're just riding the wave of just augmenting the normal growth and development. As opposed to the adult, where you're trying to regrow bone and you're dealing with hard compressive forces and a lot of history with gravity and a lot of trauma and injuries, more traumas and injuries in children typically. We can start as early as 3 and 4 years old with children. They just have to have enough molar eruption to be able to seat the cribs, and they have to be compliant enough to sit in the chair.
Yes.
That's it.
That's it. I love it. I love it.
Yeah. And we do a very simple design. It's always very, very simple design.
Yeah. And tell me about the role of the osteopath in the process, because it's not just the dentist or the practitioner that's providing the ALF. Everything's being monitored and checked, and the intuitive hands of the osteopath. How important is that for this process?
So it is extremely important for the complicated patient, and in my book I go into that. I've presented cases. I presented for the mentorship program, how to assess your complicated, difficult patients. How do you, that first visit, be like, oh, okay, this is what I'm going to need to see with the osteopath. So I want to start out by saying, not everybody who has the ALF has to see an osteopath.
Okay.
It's just not everybody, and not everybody can, and not everybody can see an osteopath that specializes in cranial osteopathy. Some people are seeing cranial psychotherapists, and I've written on that in my book and on my website about the difference between the two. If you find the magical, amazing cranial psychotherapists, they can be extremely helpful as well. So let's start out by saying, with children, if you're a dentist and you're interested in doing the ALF approach, you absolutely have to do a birth history. You have to do the history of the mom, the pregnancy, the birth history, the nursing history. And the reasons why is because if something went wrong there, say there was like a lot of compressive forces at birth, the baby has torticollis, the baby came out with forceps, the baby came out and couldn't nurse. Not being able to nurse at birth is 100%, not always, a tongue dysfunction. No, it is a tongue dysfunction. It's not always a tongue tie. So
Okay.
many of the people think it's a tongue tie, and it's not. It's actually compression of the cranial nerves at the base of the cranium, including the hypoglossal nerve, which can get compressed, and now we have a lazy tongue. So
Yeah.
if you have to take a good history to be able to see, this baby needs to see a cranial osteopath, right? And because that is going to create crowding teeth syndrome,
Got it.
without a doubt.
Yeah.
Again, teeth don't come in until after we have the function. If we have dysfunction before we have teeth, the position of the teeth are going to be dysfunctional.
Yeah.
So that's a use for a cranial osteopath. The other one is trauma injuries. If someone's had a head injuries, if they have TMD, it's important to see a cranial osteopath because our job is to balance out the neuromusculoskeletal system. And then adults. In an ideal world, first of all, in an ideal world, there would be a cranial osteopath treating at birth every baby. That's my ideal world. And I go to every single birth that someone asked me to go to. Every birth, every day. Those transitions are just amazing and beautiful.
Mm.
An adult who's had a lot of injuries. It's the ALF process goes 50% faster if that adult is seeing a cranial osteopath as well as the ALF dentist. Because our jobs is, again, to make the body soft, mobile, have pliability to it. And when we do that, the ALF forces are more, effective, but also predictable. So let's work with this. Say we have an adult, a teenager even, who's had multiple head injuries on this side, right? This jaw joint's going to function different than this one. This tissue through here is going to be more compressed and tight. When we put the ALF in and we start to adjust it, we're going to notice that this side flares out. So this side is developing and this side is not, right? And the dentist is going to be like, I adjusted them the same.
Yeah.
Why am I getting different results? You see, because the ALF appliance is not a bully. The palate expander, it doesn't matter because the forces are more than the physiological forces. So it will win. But the ALF appliance will not win. It's what we call an indirect appliance. It's going to augment where there is motion, and it's going to not expand when there's met with a rigid compressive tissues. Do you understand?
Yeah.
So that's the reason why seeing an osteopath to soften and take out these compressive forces allows a more symmetrical development of the ALF and therefore development of the palate.
Amazing. Yeah. Oh, that's so important. It's so well thought out, you know?
It is.
It's so well thought out. It's very
Yes. And in terms of like health, you think of it as when we're talking before the obstacle. So the obstacle for the development of the palate has to do with the compressive forces here. So we want to remove the compressive forces and allow the ALF to be able to do symmetrical bone development.
Let's say you were having a conversation with a conventional, centralized, everyday allopathic orthodontist. Because I've had orthodontics as a child. I had two good premolars taken out at the top. And everything I know now, I'm like, why? Because I have issues, my left ear, it's, just like you said, headaches since orthodontics, so that's a long time of this general tension all the way down the body, right? I feel that I'm very sensitive and very tuned as well. So it doesn't help that I'm very aware, right? 2 teeth taken out. And, often people have 4, depending on their situation. And they are rooting for that as a method through which to straighten teeth. In fact, recently, maybe a year ago, I sent a picture of my teeth to someone who had studied with a couple of years ago and said, and she's now a consultant orthodontist. And I said, it's looking a bit wonky. What do you think? She said, you need 4 more teeth out. I was like, absolutely not. No way. That would destroy my face. But that is, with best intentions, because that's what they're taught. And it's nothing to do with someone trying to be mean or anything like that. But that is what is being done in the conventional centralized spaces. So if you had an orthodontist here saying, that's what we're going to do, let's explain to your everyday person and the orthodontist why that versus what you're suggesting is perhaps not the best approach.
Well, it could be a difficult conversation depending upon how fixated uh, we would both be in our opinions.
Yeah.
So what we would need to have is curiosity to be in this sphere. And if curiosity is there, then we start the conversation by talking about what the purpose of teeth are.
Yeah.
And they're not just for chewing.
Yeah.
They're also to stabilize the jaw, stabilize the hyoid, stabilize the tongue, as well as have a neuroreflexive integration to get that tongue up. And then they're also the position of the mandible and the maxilla are extremely important in terms of creating optimal space, which is behind the tongue, in front of the neck, which we call airway. So this is all the development of the airway dentist. I love it. I've been involved, like, again, 3 decades in this world, and I've watched airway dentists develop and bloom. And these are the dentists where their minds went, wow, what I'm doing to the teeth is affecting the space just behind the tongue, which is the airway, which is making a huge difference in people's lives. So I would probably talk about airway space with them because it's not that far away from the teeth. And there's already this specialty of airway dentistry that's blooming. So there'll be colleagues for them to be able to talk to about. But when we pull teeth, we diminish the oral volume and we get bone loss.
Yeah.
So we don't want to diminish the oral space. We don't even want to push things back. We want to come forward because that's what normal growth and development is. And I may even hand them the book from Enloe, which they probably had to read in dental school anyhow. But this book, was the basis of anybody studying dentistry. And it talks how the face grows down and forward. So to optimize health, we want that forward growth, but we don't want to do it too hard and too fast so that we actually extrude teeth. We have to be very aware of the tooth to bone connection. So how do we grow bone and allow the drift to happen that is not in a way that pushes teeth outside of the bone and compromises them? But pulling the teeth decreases oral volume. That brings everything back, diminishes the airway space, and that's not going to be leading towards health. So it's not about, we need to widen our perspective outside of the oral cavity and just how the teeth come together and look at health in general. And that's what's happening. Dentists are doing that, and they're calling themselves airway dentists now.
Yeah, exactly. What do you think about these nasal dilators and mouth taping?
So, love it. This is something that myofunctional therapists have been suggesting for decades and decades. Taping is the way I work with taping is that I don't tell someone to just tape at night, right? I have to assess their airway. I look at what we call their Mallampati score. So that means that when they lay down, I look at how much of the archway can I see. If I don't see much archway, I'm not going to have them tape because their open mouth breathing is keeping them alive and healthy. I also am always assessing nasal breathing. So I work a lot as a functional medicine doc. I work a lot with allergies. If they can't breathe through their nose, you can't ask them to tape because they can't breathe through their nose. So why can they not breathe their nose? Then I go into doing testing to find out about allergies and so forth and what we can do and go down that whole pathway. With children, if I can see that, if I've convinced myself and I'm comfortable that it's a habit issue, so we have a habit of open mouth breathing, then what I'll say is let's start taping during the day. So I say if they're reading a book or if they do screen time, we'll do a little bit of tape. And so every time they do screen time or reading a book, so their nervous system is now going to get comfortable with lip seal. And then we move towards nighttime. And usually with nighttime, it takes at least a month. You kind of wake up and the tape is on your hair and on your clothes, on your bed covering. So it takes about a month to habituate to keep it actually on. And for some people, this is the game changer. This is all they need. They were just habituated to be open mouth breathing, but they can breathe through their nose.
Yeah, beautiful. I love all of this. I'm like, digesting as you're as you're speaking, like really taking it in. Facial intraoral massage. So, facial massage, intraoral massage. What do you think about that? Tell us your wisdom on this topic.
I love it. I love it. And if we don't assess the swallow,
Mhm.
all of that is not of addressing root cause. So
Mm,
I have patients, you take your fingers and you just bring your lips slightly apart so you're inhibiting your facial muscles
yeah.
and swallow. And if you're not able to swallow, or you see spit coming forward, or you feel the pressure of your tongue pushing on the back of your teeth, you have what's called an anterior tongue thrust.
Yes.
No amount of massage or intraoral work and massage is going to change that. That needs something like a myofunctional therapist to help you walk through breaking down the swallow and rebuilding it. And we also need to look at why someone's anterior tongue thrusting. Usually it's because they don't have a good airway.
Mhm.
Our tongue is our most potent orthodontic appliance we have, is that tongue of ours.
Yeah.
And its primary job is to create space, airway, and to protect the airway. So it'll do its tongue gymnastics, which will change the face muscles. So the
Yes.
face muscles will contract depending upon the tongue gymnastics that's going on intraorally.
Yeah. Yeah, that's me. That's me. Like I'm tongue thrusting, but I do feel like with awareness over the last year, I've really managed to get my tongue to sit where I want it to sit, without any, training or going to see anyone. But that's definitely on the cards too. Just have to find the right person. Um, but let's talk about me actually, because I think it's good for people to see someone and then be able to talk through what you might suggest. So I have facial asymmetry. I don't know if you can see. We get slightly going off that side. We've got a lot of pain in the left TMJ. If I bring my teeth very forward, you might be able to see that we've got this tilted upright fall.
Yes.
Slightly tilted. Oh, it's very bright, isn't it? Um, Lots of tilting of the lower anteriors, and I'm quite proclaimed, if you can see.
Yep.
Um,
And an anterior tongue thrust.
yeah, yeah. So let's say there's a patient similar to me who has come to you in adulthood, having had childhood orthodontics, having had extractions. What is this kind of process? The consultation we get, we're going to ask all those questions. What process would you kind of envision for them? Because people have to be patient. This isn't an overnight fix, right? It's going to take a while.
Well, it actually can be an overnight fix depending upon what the symptoms are. But we have put ALF appliances in children. We had one child, we put it in, she was autistic and she made eye contact within 24 hours. And now she has no more autism. Still on the spectrum. So it's a neurological device. It drains the brain, it drains the sinuses, it drains the middle ears. So if you're wanting to optimize the function and the motion of the cranium, as soon as you put it in, it has an effect.
Oh my gosh, that's beautiful.
What takes some time is the development of the maxillomandible and changing of teeth position. But
Mhm.
once again, we're not big cheerleaders of that being the main goal. The
Yeah.
main goal is that this is a functional appliance. So like if you were to see me, I would ask, well, what was the cause for you needing orthodontic work in the first place? So
Mm.
do you know?
As in the presentation was crowding these canines out the arch really high, very proclined upper incisors. I was definitely very class two. Um, I still am slightly skeletal. Um, yeah, crowding, lots of crowding, quite
So
narrow
that
arch,
so crowding is a symptom. Now
right?
we're going to start in crowding. So we have to look underneath that and
Yeah.
say, why was your tongue moving in that direction? And so here are some of the questions that go along that to try to be a detective and figure this out.
Mm,
One, is there a tongue tie? So if there's a tongue tie and you don't have that full range of motion of your tongue, you're going to go forward.
mm,
So ruling out tongue ties. Two, ruling out missed neurological integration. So usually when we are somewhere between 1 and 2, and we get those molars, our 2-year molars come in and they touch, that's supposed to create a neurological experience where our tongue goes up to our palate and we start going into up and back swallow rather than a forward. If we have trauma during that time, if we have prolonged nursing, prolonged bottle feeding, that can create the body to continue doing that forward infantile swallow and not transition into a mature swallow. That can be a reason for an ongoing anterior tongue thrust, aka class 2.
Yeah.
So I would want to have a really clear understanding of why your tongue was doing what your tongue was doing to create that structure before I start making any suggestions in any direction.
Got it. And, a lot of what you're saying, I had quite an intense childhood, quite traumatic in many ways. And I believe I was mixed fed and bottle fed for a prolonged period, as well as I had meningitis. So lots of steroids, lots of trauma, lots of lumbar punctures, freaking out about being in hospital, all of those things. So it makes so much sense. I think my birth may have been okay. My mum, I don't believe she's had any interventions. I'm pretty sure she's just done it. But yeah, it makes so much sense. It makes so much sense.
You can also see in your head, it's slightly tilted down to the left. So you've got a little bit, and that SCM is tighter on this side too, which is always pulling on that temporal bone, which is going to create jaw joint problems.
Yeah.
So most likely the reason, because so for you, what I would start with is how do we integrate the neuromusculoskeletal system so that we can get the best tongue position possible? Because when we have TMD and torticollis, the tongue usually jets out to the other side to balance out the cranial base, right? So you're down on your left, and most likely your tongue thrusting to your right, which is the reason why you have that one tooth is it slightly out, did you say, on that right?
Slightly
in. Slightly in. Yeah. So, I don't know. I'd have to put my hands on you and open your mouth and see and watch you swallow. But the tongue gymnastics has to be understood before, again, we start to move the structure, which is just going to relapse.
Yeah. Yeah. Yeah.
When someone gives me a history of meningitis as a baby, I know that there's cranial restrictions.
Yeah.
That's what causes it, is that you don't have good motion in the meninges and you don't have that good brain drain. And so you're more susceptible to a virus or a bacteria, right? So motion is health, because motion is also optimal blood flow and venous and lymphatic return. So that's the basis of osteopathy, is that we're always trying to optimize blood flow. So wherever we don't have optimal flow of blood to and venous and lymphatic return away, that area is set up as a dis-ease and a compromise for disease. So again, it's the why. Like, why did you get meningitis, right? Why does someone get pneumonia on the right side, not the left side? Well, most likely the ribs on the right side don't move as well as the ribs on the left side. So you don't have that action of pumping.
Yeah.
You pump the lymphatic and the venous drainage.
Yeah. Yeah. Oh my gosh. So much knowledge, so much wisdom. I'm loving this. Talk to me a little bit about the connection. So the fascial connections, just the structural connection between the jaw and the pelvic floor. Because I do spiritual mentoring. That's my other thing that I do. And I work with women also in their health, and we kind of weave the pieces together. And a huge issue that many women have is tightness of the pelvic floor. And from your perspective and from your expert area, what would you say is the connection between the jaw and the mouth and the face and the pelvic floor, and pain on penetration and even difficulty in delivery, which you've touched on already?
Yes. So this is also on my online program. So if anybody wants it to be spelled out more clearly than I'm going to do now, it's on there. The face is recapitulated in the pelvis. What I mean by that is that the structures that look similar actually function similarly. For example, we have a long bone and ball and socket And in our femur is a long bone and a ball and socket joint. And our arm is a long bone and a ball and socket. So
Yeah.
when we have jaw joint issues, it's capitulated here and in the hip.
Mm.
Our eyes are about the same size as our ovary. Our nose is the same consistency as the cervix. And the mouth is the same mucous membranes as a vaginal opening.
Yes.
You take your face out and put it down in your pelvis, there you are.
That's amazing. Just because when you do facial reflexology and you're working on the reproductive system, that's exactly the way that it's mapped onto the face. So yeah, that's incredible. That connection.
So when this is tight, and this is the diaphragm, right? So this is a diaphragm here. Our palate, our soft palate's a diaphragm. We have a diaphragm on our head called the tempora and the tentorium. We actually have a fascial connection here that's called the diaphragm. We have the thoracic diaphragm with the pelvic diaphragm. We have the feet, that's another diaphragm. And diaphragms basically are just slips of muscle or fascia that cross the body and create a compression container, basically.
Yeah.
When the thoracic diaphragm is tight, the pelvic diaphragm is tight. It's actually a circle between the thoracic diaphragm and the pelvic diaphragm. So breathing, and that's why breathing and breath will open up our pelvic diaphragm, and breathing and breath will also open up our jaw. So anything that relaxes here is going to relax also our pelvis.
Mm-hmm. That's, yeah.
Clenching. So if everyone who's listening to this, just like, let's just do it. If you clench, can you feel your pelvic diaphragm lift and clench?
I can actually.
Exactly.
Yeah.
So people with clenching, which we do to lift our soft palate because we have an airway dysfunction, or even just grinning and bearing life and moving through life because we don't have a feeling of comfort and stability with an openness. And so we're going to contract. That is going to cause chronic pelvic contraction.
Yeah. This is incredible. Incredible. So in summary, the way that people can learn more about this is they can get in touch with your book, which is probably very accessible. They can do the online course, which is, I expect that they will have a time limited access or something like that. And that doesn't mean you can then go off and do the treatment, right? This is just introducing you to the appliance, its capabilities, its mechanism of action, having you think in a different way, all of those things. What then enables someone to be able to actually be a practitioner of the ALF appliance is to join your mentorship program. Is that correct? Or is there another aspect to it?
That is correct. So the book and the online, there are different information in there. So even if you've got the book, there's much more information online. Online's probably more geared towards the practitioner. The book is a little bit more geared towards the public.
Got it.
Yes. That then the online course has developed into such an extent, if you have to sign up as an annual member to be able to look at all the past meetings, but there's enough information there now where someone could definitely know how to design the ALF, put the ALF in and adjust it. So we've had like at least 2 hours of wire bending and how to adjust and how to wire bend. That is, someone had access to look at that and watch that, they would learn some how to activate the wires. And then the program, the mentorship program allows them to consult. So it could be consulting. I have to say though, if you can do an in-person course, that is also so helpful. It does look like Dr. Mew has invited me to the UK to teach. So it does look like maybe in 2025, I will be in the UK and I would bring an ALF dentist, faculty member dentist with me to learn wire bending and so forth. So that is something that I have a feeling is going to happen.
Okay, that's really amazing to know. One question I missed was, what is the material? What metal is it?
It's called yellow alloy wire. So it's a certain mixture of different metals that allows that resonance with the cranial and facial motion.
Okay, amazing. Amazing. Love it. Love it. Thank you so much. I have been inspired by, I don't know if you've ever heard of The Diary of a CEO. It's by a guy called Stephen Bartlett. And at the end of his episode, he will ask the current guest a question that was left by the previous guest.
Oh, lovely.
So, yeah, so the previous guest was a guy called Greg McLeod. He has an Instagram account called Project Airway. It would actually be very interesting to hear you both speak together. So he's done a lot of airway interventions on himself. He owns a gym and he does a lot of sport, and he had a hockey injury, and he ended up doing a lot of the SARPI and Vivas and all sorts of interventions that I'd never heard of, but I learned about in my last conversation. So he's the one that left this question for you. So I'm going to ask you and see
Yeah.
what comes through for
What
you.
happens?
See what
Yes.
happens. So, how do we do a better job helping those that we love bring out a better version of themselves?
Oh, I love that.
Yeah.
How
Okay.
do we help
Yeah. So, how do we do a better
other
job
people?
at helping those that we love bring out a better version of themselves?
Wow. Well, I'm trying to think of what would be a universal answer to that. I initially want to say is listen to them and find the obstacles of their health,
Mm,
but that's going to be very individuated.
yeah.
But if I backed up and like, what's a universal response? I would remind them of something that my father taught me, which is that it took 3.4 billion years to create us. He was a cosmologist, so he studied the unfolding of the universe from a scientific perspective and a spiritual perspective.
Mm,
So if it took, let's just say, if it took 3.4 billion years to create the product of you and I that was born at birth, don't you think we're perfect as is?
yeah.
Meaning that anything that the mind says we need to do, the mind says that we're not good enough, all the mind chatter that's really like not helpful, all of that are just thoughts that are just not true. Maybe that.
Love- I love that. Just reminding them of the miracle and the process that's taken place to make it possible for them to be here and just be like, you're amazing.
We are all miracles.
Yeah,
Not that there's not things that we necessarily have to tend to. We do need to tend to things, but we really are miraculous to be here. And to feel and be that is to live with gratitude.
I love that. Thank you. And what question, you can take a moment to just
Hmm.
feel into this, but what question would you leave for the next person that's going to come along?
Do I get a hint on who that is?
I don't
No.
even know who it
Okay.
is.
Okay. Let me think of a generic fun question that has to
Yeah,
do with transformation.
anything. It could be
Um,
so random.
oh, what would you say is a unifying force for all human beings,
Love it. Love it.
right? Like,
Yeah.
where can we always come together and be like, yep, I got you, rather than the divisions?
Mhm. I love that. Thank you so much.
Yes,
You've
thank
really
you.
enlightened me. I've learned so much, and I can't wait to listen to this again. I'm so excited. I was sharing with the my colleagues of the practice that I'll be joining later on in the year. It's a holistic wellness center and the dental and wellness center. And one of the girls was like, I love her. Like she was fangirling over you. She was like, I can't wait to watch. So
Wow, wow, how wonderful.
yeah, so
I really appreciate what you're doing. I appreciate you coming from the perspective of transformation, which is so inspiring. That's really what it's all about. And I appreciate your reach out. And I'm excited. I'm excited to see what is to come.
Thank you, thank you, thank you. The amazing Dr. Tasha.
Thank you
Let's
so
keep in
much.
touch. And I hope you have a beautiful day. It's evening here, so you can see the sun's totally disappeared on me. But have a beautiful.
Lovely.
Thank you for your time.
Yeah. Thank you.
Bye.
Bye bye.